Good afternoon to all. Welcome to today's session on myths and beliefs that affect fertility by Apollo Fertility. To speak on the topic today, we would like to welcome Dr. Vijaya Geeta Patangi, in-house consultant for fertility. She has done her PhD in clinical health psychology. We welcome you, Doctor. You can now take over the session.
Thank you. Hello, everyone. This is Vijay Geeta, clinical health psychologist from Apollo CM Fertility. Basically, my research is on behavioral endocrinology and reproductive medicine. Before to begin, I am in a closed room, so that's why I'm not wearing a mask. So who are my viewers? If you are in a group or gathering, kindly cover yourself with a mask and maintain social distancing. With that as a small brief, I begin my session. And the session is all about myths and beliefs that affect fertility. We as humans have evolved a long way down. Family, culture, family members are very important. So is our religious and cultural well-being. And there's always an associated act or belief or a thought that makes a person do things in a particular way, expecting that it would all happen correctly, right? So how do we know that when you do in that particular way, the output is true or beneficial enough? So it comes in the factor of health, very specifically infertility treatments. My grandmother said that, my neighbor said this, my own friend who underwent the treatment did this. Well, they are all subjective or not well established to say it works for everyone. So that is the reason has stemmed this important topic on myths and belief. What needs to be considered? How thought process can affect your fertility? What are the points to be just followed? Is just following the points in your path will lead to a fruitful result? Well, yeah, and otherwise, why you and me are sitting and discussing? What are the pros and cons? And how does it affect your dream come true, which is your parenthood, is all something that we will be good looking into. I honestly encourage everyone to post whatever myths and beliefs they carry. In the meantime, which whatever I have seen in my practices, where patients would ask about to say, oh, I did this to enhance my fertility, I did that in believing that it would improve my condition. We will see a few in the path. Well, very first, foremost, and the important factor is age. Age plays an important role. Usually, what is the common thinking? It is only the women. So usually we see by our past that men were overaged in compared to a female. So that the age gap between the couple would vary somewhere from 5 to 10. Sometimes we see 15, 20 years too. So if the couple is not planning for a progeny, well, age doesn't matter. But if the goal or one of the factors that as a family that they would like to do together is establishing for the future generation, then age does matter. Initially, it was thought age is only for females. Why? So from birth, females do carry ovarian reserve, which we all uh, look into as an important factor from the onset of the menstrual cycle or the puberty. Since this ovarian factor decreases or declines its potentiality as the woman ages, that is why age matters comes to a point and more on concretely focused among the females. However, there are other factors that also put together, and we've always seen that how come my neighbor who's crossing 40 years have conceived naturally, whereas at 21 it's a struggle. We look into some of the nuances. Second important factor is nutrition. Poor nutrition lowers amidst the odds that is being faced among infertility treatment. Let's say there are a few odds that comes up during the treatment cycle or during planning of any pregnancy. Along with that, if the lady or the woman tends to not eat properly, not eating on time, food on the plate is not well balanced, then there are nutritional deficiencies, which is being checked through a blood test. They do add on and affects whatever odds that the couple is facing towards their dream. Nutrition plays an important role. I think we did a complete session on the vitamins and its impact in fertilities. Lots or most of the vitamins in the spectrum of vitamins that is required for a healthy human being to live, three-fourths of the vitamins has a role, at least a couple of vitamins directly play an important role towards the fertility aspects. It need not be the same for everyone. However, considering them is very important. Looking into this aspect, your well balanced food, eating food on time, nourishment, balancing your nutritional component plays an important role. It can bring down a few of the odds that is causing a struggle in achieving your dream. Most important point, 21st century people. Smoking is fine as long as I quit when I'm pregnant is one of the tagline that most of the dynamic women would think about. Why not women? Even men think about. So it is not a overnight improvement that is seen. If a family is planning to extend the family, usually the women is more anxious compared to the man, because she becomes the prime of focus to listen, to cater, to adhere, and to coordinate and follow every single point that is being told religiously. And when it comes with habits, because self-care has a direct impact on your well-being, like a nutrition or some activities like a smoking or drinking that affects the quality or the conditions of your cells and improvement in your body. Well, then the doctor would say the first question asked is, what are your handling habits? So some would say occasional smoking, occasional drinking, party smoking, party drinking, or a regular smoking, regular drinking, or heavy smoker, heavy drinker are some of the categories that we see a couple or one of the couples would fall into. But it is nowhere, including through the monitoring, we've seen that the condition that has been deteriorated because of the impact of the past history of this habit changes overnight. So if you are planning to be having an extended family, let's say down the year or two, it is better that you modify your habits. And the first and the foremost habit which was told is to have a balanced nourishment to all your cells for the health and the wellness being, which is nutrition. Also is your caretaking of your habits. First and foremost is smoking. It is better that you quit, not the day before you become pregnant. The most important search engine when any person would say is, what are the foods that would support pregnancy? What are the foods that will impact a good egg quality? What are the foods that will improve my sperm quality? Well, if you run through Google engine, the search machine carries a certain words: foods, affects or effects, and fertility. Do they really have an impact? Is it directly or indirectly? Food is the first natural source where the body looks towards in nourishing itself. So, food plays an important role. Unless or otherwise, if there are particular food that is causing an allergic reaction, that is causing sickness in your body, everything is good. There is no hardcore fad diet called fertility diets. What are some of the other things that we listen? Fertility smoothie. I don't think so. But always having a well balanced food is very important. One needs to eat everything. Wow. Before getting into my next own questions, let's welcome a few questions from my viewers. Can laptops impair sperm production? Is it true? It is not a direct impact. Sometimes there is a correction in the position stating that do avoid keeping laptops on your lap. It's simply because it's the engine is placed at the lower level of the laptop, and it is really hot, and you tend to sit on a heated area prolonged time. Though there are no direct evidences to say, recently the search engines like, using mobiles in your pant pockets reduces your fertility aspect, has no direct evidence. So is a laptop on lap, has no direct evidence. However, ergonomically, if you see, it's not the right way. So use the laptop on top of the table. This brings in a good seating position, as well as your body's stress is well, balanced or much reduced. It's, don't you think it's highly inconvenient to lie on your back with laptop on your lap and trying to do something, and then your entire area where your laptop is resting is all heated and your skin turning pink and sweaty is not a good sign. Well, that causes definitely a stress. Does stress affect your ability to get pregnant? Well, yes, the most important myth. Who does not have stress? Everybody has stress. Stress, the main cause. To a great extent, yes. Why? Because it always shows one's ability. It says that you're not well planned to, do your everyday events or your regular activities or towards a plan. It's not like you wake up in the morning and you're thrown 10,000 things at a time and you're like, oh my God, wait, let me gather my thoughts. And, you tend to focus on one, and then the other thing comes out, and then you focus on the next one, the other thing falls apart. It's not like that, right? We are a well developed intelligence, we have a well developed mental factor, and we tend to use our equipments right, which is our brain. So thought process, thought management, when applied properly, your stress reduces a lot. Rather than doing a work with irritation and nagging, you would do your work joyously as well as wholeheartedly. Job well done. Today's work done. Have I achieved my target? Yes. Is today's goals accomplished? Yes. They're not the complete goal, but a small portion towards my larger aspect. Are we heading towards our goal? Yes. This brings in a sense of happiness. Are you contented at the end of the day? Well, it should be yes, because most of the things you've achieved. And this is where self-help program like, mindfulness or being aware of what you are. Why did I get irritated in the afternoon? Let's look for focus into it. Have a self time or a me time, at least 10 to 15 minutes before retiring to bed, to just run through the day to check were your day fruitful, so that it's not about uh, gauging, judging, or validating yourself. It's about to plan your next day. So reiterating and having a well planned thought process always leads to a, better life. I put, you will be able to handle more tasks much easily. So I do not think so stress will be of a big issue. However, during pregnancy, you should always be mindful that there is always a baby. So you are pregnant and you're also doing a particular work. So have a well planned work. If something comes new, rather than becoming upset or anxious on going about how to do it, set a part and chart it out so you can handle your work efficiently. That's more important. I guess so I've handled the question to a great extent. But if you ask, will it affect the ability to get pregnant? It is yes. So one needs the help of a health psychologist or somebody from the doctor's side. Will this activity affect? Can I do this activity? What would be my lifestyle if down the lane in this 1 year or 2 year, if I'm going to plan to extend my family, what are the habits to be inculcated? What would be my lifestyle to put it on the go so that it gathers momentum and gradually that becomes a way of life is very important. Is it true that after an egg is released, it can be fertilized up to 2 days? Um, Once the egg is released, it's only a duration of 24 hours. So 2 days, I'm not sure. You can check with your gynecologist. Being on the pill for too long will delay pregnancy. Is it true? So first question itself comes is, will the pill be effective enough? Will be the first question. But being in the pill without a doctor's monitoring is like not good. So if your doctor recommends the pill not only to postpone your pregnancy but for any other um, gynecological or infertility issues, well, under the doctor's supervision, it is a part of your treatment management. It is not always the negative to be considered. So get back to your doctor for looking for the after effects. Is infertility mostly a female issue? Haha, I'm trying to address that only. The answer is strictly no. According to World Health Organization, the current statistics states that 40 percentage of the female are responsible for the female aspects, 40 percentage of the male are responsible for male aspects of infertility. 20 percentage is the factors of something called unknown infertility. Despite everything being true, correct, sometimes pregnancy doesn't happen. So there is a window of 20 percentage. Caffeine inhibits your pregnancy odds. Is it true? Not directly, but too much of caffeine makes your body hyperactive, which some feel to be, yeah, it's good to have at the end of a bluish day, it's good to pep up and all that. Once a while is okay. If not, it's going to affect your sleep cycle, which is the most important part in any couple who are planning for pregnancy. It can be a male as well as a female. Sleep plays a very important role. The 8-hour minimum duration of rest not only rejuvenates but revitalizes as well as replenishes factors that is required for a healthy conception. So please note that sleep has its own role. Okay, as of now, those are the questions. I'll get back to my presentation and get back once there are fresh questions. We did see that foods affecting infertility or fertility, there is no direct correlate that a particular food, when taken, the fertility aspect of a person gets deteriorated. It is nothing to say but to have everything possible so that your blood is nourished with all vitamins and minerals and components that is required not only for a healthy well-being but also towards your conception. There's the question. Caffeine inhibits. Caffeine, your beverages, your tea, coffee, on noted consumption levels like a little bit or a cup or two a day is not going to take much toil. But drinking too much of coffee or caffeine at the end of the day disturbs a person's sleep. So he or she is forced to be awake. But if you say, hey, madam, that is my agenda, that the reason to drink coffee is to keep me awake, well, it does affect. And sometimes, let's say you are working at odd hours, the most important question. I work for an UK time, I work for an US time. How to go about with that? Yeah, we do need our kicks, our caffeines, to start the day, or we do need caffeines to extend the day. So, but we will also plan, okay, I have utilized this much of my night time, let me sleep and compensate for that. However, this habit outcome was not so fruitful, but we only see that the stress levels have come down, but the mental disturbance still exists. So indirectly, if you see, might affect your hormones, which still stands true. Let's look into the next one. Stress reduces fertility, or stress causes infertility. Anything can cause a stress. Unplanned day can cause a stress. Irregular eatings can cause a stress. Poor diet which is not sturdy enough or strong enough that gives you the ability to maintain the activity, can lead to stress. Mental fatigue can cause stress. Overall physical body fatigueness can cause a stress. You turn to become blue and not able to think clearly. There's mood swings, there's hormonal fluctuations. Also on mild moderate treatments for, let's say, you're regularizing your periods, or among the male infertility also carries medications and affecting their cognitive performances, does cause stress. Well, if one does not understand why certain things happen, stress level increases. Let's say, for example, couple is planning seriously for pregnancy. What do you mean by seriously for pregnancy? There is a regular doctor visit, there is regular monitoring of the life aspect, there is regular scans to check your follicular development, there is timely medications. Okay, what's one understanding on all these 4 points? Seriously planning itself, to understand how serious depends upon what are the minutest things that's been caretaken. Second, regular visits to doctors is time consuming as well as a burden in the pocket. Have you planned your finances, and have you taken the proper time to the relevant doctor? Above all, the same doctor. And is the doctor clear with all the inabilities and some extended inconveniences that you are facing, not only due to health but also from your extended family people or your surroundings? Is it good to go through? 3, your follicular development. Are you regular at your scans? Doctor told me today, I will do tomorrow, or I will do it day after tomorrow. Are your medications on time? If at all, if you're on medications or on injections, basically hormones, what will it do to my body? Let's monitor. Are you aware that after the injections, is there a change in your mood? Have you become silent for some time? Is your anxiety too bad that every time I do Google checking, whenever there is free time, I check in my mobile? Whoever is conceived, go ask them in person, what were your challenges? How did you overcome? That says you're anxious enough, which means you're also stressed somewhere inside. So, stress does cause indirectly infertility because you're not planning properly. When compared to couples who walk into the center, looks for the right doctor, and after all a brief consultation, happy like, yes, we would like to go ahead with whatever is the doctor's advice. It can be also a natural conception, following ardently what the doctor says. Well, doctor did say something, and certain factors are not falling in the line that the way we live or the way my work is. Let's get the help of the psychologist and see how it can be worked out. Doctor gave this medicine, what will be the impact on me? I have not got any history of even swallowing a small pill. Will it affect? What are the pointers that needs to be checked? Who is my go-to person to call immediately? Am I facing any discomfort? And apart from your regular visits or monitorings or scan, are you updating your doctor everything? Are you sharing everything that you undergo to say, this was what my journey from your past visit to my current visit? this way helps a lot in doctor also looking into, okay, is this leading to something else, or is it just simple things, and there is a clear cut guideline that would be given so that the journey is much fruitful. Valid question. We did speak only about smoking. Where did the alcohol go? Does alcohol boost your chance of pregnancy? Well, I do see people boozing and getting pregnant. Are there any relation? The answer is no. Just like how smoking, the nicotine affects the nervous system and the hormones, alcohol also has its impact. The opioids, like the beta blockers, they do affect your liver. Overall, they do affect your, vitality. It directly affects your cells. So alcohol has its own impact, and definitely it's not going to support or boost or encourage in either getting pregnant or during the journey of your pregnancy. Neither in your overall lifestyle it's going to be fruitful. So either to look into the chances of pregnancy or getting pregnant or during a journey of pregnancy, alcohol is a strict no no. If you are planning for pregnancy, let's say down the line, my lane is pretty long, another year, another quarter, then start modifying your habits, reduce to zero alcohol. That would bring fruitful results. A little talk can't hurt. Well, it's a colloquial term for drugs, and we all do get informations about the beneficiary aspects of hemp for marijuana or something else. But do they affect the fertility aspects? Yes, they do affect. There are major hormonal disturbances. There are major hormonal there are neuroblockers that certain drugs work as. So definitely it does hurt. So do not be into or do not get involved into any drug activities. They definitely have its impact, and it takes quite some time for the body to revive back completely. Any further questions? Okay, no further questions. Let me look back to the presentation. Nothing wrong with prescription drugs though. What do you mean by prescription drugs? As mental factors, stress, mental capability are more talked now, psychological health plays a very important role. What if there are antidepressants, anti-anxiety medications, epileptic medications, or do have a history of psychiatric factors and on medications? Well, definitely they do impact the fertility aspect of the person. Get back to your doctor if you are planning to get married to say, hey, I was already in these medications. Will they affect my dreams of planning for a kid down the lane? Since if you are already taking such medications and you're planning, your doctor will rewire the medications. If you see the most ardent place where medications are continuously monitored is the psychiatric medications. So you go to your psychologist, gather down your cases, signs, indications. Is there an improvement? Is there a depreciation anywhere? Is it affected? It is not affected. Let them go through you correctly. And if there are chances or indicators showing that you are improving, then there are greater chances of doctor reducing the medications. So that is how psychiatric drugs are always constantly are on validation. They do have its role in impacting the fertility of the patient or the person, and they can be rewired or they can be altered to some other better medicine, or you can be put on psychotherapies to see to reduce the medication or to nullify if required, if there is a great chances or seen evidences of improvement. So prescription drug is not wrong in taking. It's only that you need planning. Down the line I might plan, so let me stop everything now. Oh, no, that's incorrect. Down the line, I might plan, and I'm recently heading towards from simple depression to a clinical depression. Do I need to meet the doctor? No, this is also wrong. So, look into the aspects of getting treated, whatever is your current condition. Generally, or usually, when you visit any doctor, they would definitely ask, are you planning for a family? Or do you have any children? If the answer is yes, then they would prescribe or put you on medications either on a less or no impact, or they would say, get back to me if you're planning, I would change the medication. So, what is the takeaway from here? Heading towards the right doctor is very important. Your overall health doesn't impact fertility. Is that true? It is really very true. Your weight matters. I am too overweight, does impact. I am too correct to my height, does impact. I am eating properly, but I have selected foods to eat. I don't like greens, I don't like pulses, I don't like veggies, I like this, I like that. Well, all this is definitely is an imbalanced intake of food, but according to you, if you're eating regularly, still plays a role in impacting. Too much of stress, too much of work, or too sedentary and no work, working at wrong time and not taking care of the rest factors, too much sedentary life, little or just no exercise, all this are all your overall health. On the whole, it will definitely impact. Let's compare this with a couple who is doing everything. Right time of the food, right time of the event, right working space, right nutrition, right bodily weight and exercise, right outcome, right visits to the right doctors and the right tests and the right treatment taken. When compared to both, the overall journey of such couple achieving their dreams is much smoother than compared to the couple who are having doing things according to their own way. So your overall health is very, very important. I smoke, I quitted yesterday. Do not expect that today your blood test values will increase. 2 months back, I was a heavy drinker, and then I have completely stopped drinking. So will that improve the fertility aspect? No, but definitely you will be gauged to looked into what is the history of the alcohol consumption and how much it has affected. Do the person require any supplements, antioxidants to put him back into the nourishing tract? Do they need any other support for the overall well-being? All will be taken care by the doctor, and then you have to go around in that for quite some time until you reach your goal. So do not neglect. There are 5 things that needs to be done. One of the thing is to give away bad habits, but um, I will not do it. That is never correct. Overall means overall. You need to look the entire 360 degrees for a complete wellness being. Such efforts have always been fruitful, and I've always seen them to be fruitful. Infertility is typically the women's fault. Female age doesn't matter as long as you are under 35 is a current trend. How true is this? Um, with more men coming up and getting themselves tested, it's good that the personality has accepted to see this is just a inability and not an disability. This understanding is getting into the male society, but it is completely cannot be neglected to say it is a complete women's fault. Both the men as well as the women of the family would be tested on the relevant parameters. Current trend see that women who are now focused on not only a good education and a career, but also a competing career, competent, constantly evolving, constantly growing factors, um, who's trying to climb the staircases in their businesses, do tend to see or procrastinate or sideline. I'm just 30, let me marry next year. I'm just 35, let me marry next year. I'm not yet 35, so I can plan my pregnancy after some time. Good, but not so good. Does this factor is a healthy line of thinking? Um, Being competent is healthy, but procrastination is never healthy. What such people can do, forget about the female, including the male. It is always encouraged, as told previously, and also iterating again, is visit your nearby doctor, get yourself self-assessed or check, like a master health checkup, right? What you do every year beginning, you tend to run some tests to check all your major internal organs are functioning correctly. If all fall within the normal range, the doctor says, congratulations, you are healthy and fine. Walk in your everyday aspect of life, follow your the regular healthy routine. If there are challenging stressful situations, deal with it, get back with it. So as of now, whatever you're following is correct, is what it indicates. Also add on to your fertility aspects if you're planning for settling down in your marriage. So looking into that parameters, if everything falls into normal range, well, then age is not a big factor to procrastinate your marriage until 40. Age is a matter, is the very first mythical point that was broken. As age increases, the reproductive aspects, one of the aspect is ovarian reserve for a female, has its impact. As age increases, the functionality deteriorates, but it is very subjective on case to case basis. Not everybody's lifestyle is same. Not everybody takes care of oneself the way it has to be. So a lot of factors come to the picture. So do not procrastinate would be an answer for this question. The most common myth, when at least a few years back, if we would see, if the semen analysis from a male says in the ejaculate we do see, the normal sperm, your rapid progression is this much, your total sperm count is that much, he would say everything is fine from my side. Not necessary to be true. It doesn't mean that if a man can ejaculate, he's not infertile. And male fertility does not decline with age is a huge myth. Now, this is where we break the barriers to avoid the procrastination of males being married later in life. That's a huge procrastination out of ignorance. There's a lot of data in current study which shows that men as young as in their 20s do come in for fertility treatment, thanks to their educational background that has motivated them to go assess themselves, and something out of the blue comes out and they've already initiated to take care of it, so that whenever they are marrying and planning, this would come to offer good use. Every part of your body has to work, right? And that is what you mean by a complete good health. So this myth is completely broken. Infertility is mostly a female issue. Irregular menstrual cycle itself means infertility is one more point that most of the women would be hearing or looking into. Oh, from puberty, I had a history of a painful period cycle or irregular cycle. Oh, then definitely, you're carrying factors of infertility. Not necessary to be true. It is really a myth. To know, to gauge person for fertile or infertility, periodical cycle is one of the aspect, one of the factor. It has to be regular. Due to PCOD or PCOS, it can become an irregular menstrual cycle. But PCOD and PCOS are not cause for infertility. So break out of this myth to say this is a female issue. Monthly regular cycles are not there, and that is the reason for not able to get onto a progeny is incorrect. Couples should always try for at least a year before seeing an obstetric gynae. Um, a few years back or a decade back, if we see, the mindset of any newly married is you get married, you wait, you try for some time, or a couple would be very dynamic couple with the most challenging job, and they would see that work comes to the place. Let's establish the work, and then the lady says, "Hey, we've been married for quite some time. We've got a good work foundation. Why don't I look to settling down and then get back to the work?" And then many odds the couple had to face, and then the first point that the doctor said, "What took you so long to come?" would be a point. So we are not urging that once you are married you have to see a doctor. What I am trying to insist is, either if you're planning to get married, we do see people walking in as fertility checks. I'm planning to get married, as a part of family counseling or couple counseling. Are we prospective couples? Can we become a couple? Will things make up? Well, your parents would take your astrological chart to an astrologer. You probably would be going to a psychologist to understand each other much deeper. But what about your health charts if progeny is there in your plan? Please visit a doctor, get yourself assessed, checked. I think in one of the topics when I was talking, how to plan for a treatment or what is the right planning for a treatment, that plays an important role. If all your factors, your reproductive factors, everything is fine from the couple side, you can take some time if you're married really very young, a year or two, and try a plan accordingly. But what if some of the factors are really questionable, challenging, or falls in a range that needs a doctor's vigilation, or you need to be monitored every 3 months or every quarter or every half yearly, you need to repeat the test. We'll put you on for supportive medications, supplements, or antioxidants. If you're in that, then you have to gear up to say, hey, we need to plan now, so that let it happen whenever it has to happen. So it is not a good opinion for any couple to have. At the same time, it's not wrong to visit a doctor, right? So at least try to visit once. Infertility is always fixable. It's the biggest mistake. Doctors are not fixing your issues. If this is not happening, we are just trying to play up to say what are the other ways through which we can get you pregnant. So, infertility on the treatment itself, if you see, we are trying to manage with the help of external factors like medications to get your dream come true. Some couple just need monitoring. Some couple might need just a supplement. Some couple might need a little bit of more of an antioxidant. Some couple need a little bit more hormones to boost the fertility aspects. And then we see pregnancy. But if there are any real genetic factors or any documented syndromes, if there is issues in the blood related ailments, hormone related ailments, then definitely a doctor's monitoring will help in the management of the fertility. It is not a fixable. It's not like for the past 2 days there's headache. Doctor gave me crocin. I was on paracetamol for 3 times a day. The complete day was run. The next day I'm completely fine, fixed. It's not like that. So infertility is not an overnight treatment. So let's look for any further questions. If not, what should I do next would be anybody's question. If at all, if you hear what next is the question, then you are on the right track. Rather than looking into for answers from I'm not denying from your immediate family people, from your friends or colleagues, from your society, from your religious background, seeking answers based on your cultural background. My ancestors all had this, rather than procrastinating, self concluding, and losing not only time, with the time comes the investment of health. Will the treatment line be suitable? Will the treatment line lead to a success? All these factors would come to a picture along with the journey with a relevant doctor. So, if at all, if you are seeking, please walk in at Apollo CM Fertility, where we have experts in dealing all your queries, that covers all your matters, that makes your hopes and dreams in coming true. Before going to doctor is not is my plan, but I would really need understanding or clarity on myself. If that is your question, you can always head to a counselor or a psychologist and understand where you're standing. Knowing oneself is very important. Then you would have relevant questions when you're meeting the doctor. This will also help. So if at all, if you want to speak, you can always approach at 9686588622. Get an understanding of what you wanted, where you are currently standing, and where you would like to head to. Apply and then see, does it really requires, based on the factors do imply that time is crucial, then you definitely take a guidance and meet the relevant doctors. If not, if at all, if you have decided to meet the doctors, please visit the doctors as per your plans and ideas to make your dreams come true. So, with this, a few of the myths and beliefs. Hope this session was useful. Until next time, thank you for listening.